The CDC estimates that approximately 385,000 injuries with contaminated needles and other sharps devices occur annually among hospital-based healthcare personnel. Many more occur in other healthcare settings such as emergency services, home care, and nursing homes. Injuries with contaminated needles and other sharps devices are an important concern because they pose the risk of transmission of blood-borne viruses, and they are costly to personnel and to the healthcare system. The three blood-borne viruses of primary concern for transmission from sharps injuries are hepatitis B and C viruses and human immunodeficiency virus, or HIV. As you can see, one is at higher risk for being infected with HBV following a sharps injury than for HCV or HIV. Fortunately for hepatitis B virus, a vaccine and immune globulin are available that can protect healthcare personnel from becoming infected. The average risk for HCV transmission after a percutaneous exposure to HCV-infected blood is approximately 1 in 50 exposures. The average risk for HIV infection after a percutaneous exposure to HIV-infected blood is about 1 in 300 exposures. Percutaneous injury to healthcare personnel places patients at an equal risk. The OR setting is the highest risk for this type of transmission since open wounds are susceptible to contamination and personnel injuries often result in bleeding. A 2010 study published in the Journal of the American College of Surgeons showed that of 132 documented healthcare worker-to-patient transmissions of HIV, HBV, and HCV, 131 were transmitted during invasive surgery. Reducing injuries during surgery would correspondingly reduce patients' risk of exposure. Where do sharps injuries occur? 2022 data obtained from the U.S. EpiNet Sharps Injury and Blood and Body Fluid Exposure Surveillance Research Group show that although sharps can cause injuries anywhere within the healthcare environment, a large share, 40%, of injuries occur in operating and recovery rooms, followed closely by injuries on inpatient units at 30%. Who gets injured? Data from the 2022 EpiNet report show that nurses sustain the highest percentage of percutaneous injuries for all hospital environments. However, other patient care providers such as physicians, technicians, laboratory team members, and other support personnel are also at risk. What devices are involved? Hollow bore needles of all types accounted for 45% of all sharps injuries, and suture needles alone accounted for 23%. Other solid sharps include surgical instruments such as towel clips, retractors, forceps, and drill bits. When we look at where sharps injuries occur at UT Medical Center, the percentages are similar to the EpiNet national averages, with OR recovery accounting for 36% and inpatient units accounting for 42% of the overall sharps injuries. Looking at the UTMC data, when we examine the type of personnel throughout the medical center being injured by needle sticks or sharps, we can see that this breakdown of who received a sharps injury is similar to the national data, with team members receiving the highest number of injuries at 44%, followed closely by physicians, NPs, and PAs at 38%. When the OR location is examined separately, the personnel most frequently injured by sharps are physicians, residents, nurse practitioners, and PAs at 55% of the total injuries. Strategies for eliminating sharps injuries can be divided into three main categories: elimination of the hazard, engineering controls, and work practice controls. The UT Medical Center policy recognizes these validated methods of prevention and addresses them specifically in this policy section. Engineering and work practice controls must be used to eliminate or minimize exposure to blood-borne pathogens. Where engineering controls will reduce team member exposure by removing, eliminating, or isolating the hazard, they must be used. There are several ways that needle use can be eliminated or reduced. One way is the implementation of needle-free IV delivery systems that do not require, and in some instances do not permit, needle access. The majority of U.S. hospitals have eliminated unnecessary use of needles through implementation of these devices. Other methods of eliminating or reducing sharps use include choosing to use the blunt version of certain instruments instead of the sharp version. Some examples are non-penetrating versus penetrating towel clips and blunt versus sharp self-retaining retractors. Choosing alternative cutting devices such as electrosurgery and ultrasonic scalpels, and using skin stapling devices or adhesive strips instead of suture when appropriate. In addition to eliminating or reducing the use of sharps, employment of engineering controls, which include using devices with safety features to isolate the sharp, can also reduce injuries. Key features of these devices include: the safety features are part of the device. They provide immediate protection at the point of use and through the disposal process, and the user's hands can remain behind the exposed sharp when activating the safety feature. Safety blades have been an important engineering control to prevent sharps injuries. The safety blades are made for use with reusable handles or as part of a disposable scalpel. The blade protection devices can either be retractable or a sliding sheath. The protective device should always be activated immediately after use. Another type of engineering control is the development of blunt suture needles. The American College of Surgeons recommends the universal adoption of blunt-tip suture needles for the closure of fascia and muscle in order to reduce needle stick injuries in surgeons and OR personnel. The effectiveness of the use of blunt-tip suture needles in reducing sharps injuries is supported by a number of randomized studies and case series that demonstrate decreases in the rates of glove puncture from as high as 38% down to 0 following the adoption of blunt suture needles. The ACS statement on sharp safety says that the use of blunt suture needles should not require any changes in work practices for surgeons, noting that a new generation of blunt suture needles is now on the market with a slightly more tapered tip profile that may provide for easier suturing compared to the earlier needles used in the reference studies. The final strategy, and perhaps most important, are work practice controls. The recommended work practices that help ensure safety can be simplified into 3 quick points: be prepared, be aware, and dispose with care. One of the best ways to be prepared is to practice double gloving for all procedures, including minimally invasive and endoscopic procedures. Double gloving reduces the risk of exposure to patient's blood by as much as 87% when the outer glove is punctured. Volume of blood is reduced by as much as 95% if a suture needle passes through both gloves. The UT Medical Center policy states that personnel in procedural areas should don double gloves and utilize hands-free neutral zone technique. Double gloving during surgical and invasive procedures is established as the standard of care in the operating room and day surgery. Another way to be prepared is to use a neutral zone or hands-free technique. Research shows that 1/4 of suture needle injuries and more than 1/2 of scalpel injuries occur when an instrument is passed from one person to another. Using a neutral zone or hands-free technique avoids this situation. The neutral zone is a designated area on the sterile field where a sharp can be placed and then picked up by the user. A neutral zone space can be created using a basin, magnetic pad, or designated area on the Mayo stand as the neutral zone. There will be times when a surgeon cannot use a neutral zone because eye contact must be maintained with the surgical site. In these cases, a modified neutral zone can be used. This includes the scrub person placing sharp into the surgeon's hand and the surgeon returning the sharp to the designated neutral zone. This exemption only applies when the microscope or loupes are being used. When loupes are no longer needed, as when closing, the team should resume the neutral zone. The UTMC policy on sharp safety states that surgical team members will use a neutral zone or hands-free technique for passing sharp instruments, blades, needles, and devices. A modified neutral zone or limited hands-free passing technique will be used during operative and other invasive procedures if use of a neutral zone compromises safety. The UTMC procedures to support this policy state that the use of the neutral zone should include identifying the neutral zone in the preoperative briefing, placing one sharp at a time in the neutral zone, giving verbal notification when a sharp is in the neutral zone. It is very important to remember that only one team member at a time should handle a sharp item. Another work practice control to prevent sharps injury is using the no-touch technique. The policy states that the perioperative team may use a no-touch technique when handling sharps. For handling suture needles, the no-touch technique includes loading suture needles using the suture pack to help mount the needle in the needle holder, and using a one-handed or instrument-assisted suturing technique to avoid finger contact with needles when suturing. The photo on the right is an example of using fingers to assist or direct needle passage, which should always be avoided. The no-touch technique is also referenced in the UTMC exposure control plan when it addresses recapping of needles. The policy states that any recapping or removal of needles should be done with the use of a mechanical safety recapping device or a one-handed technique. Two-handed recapping of contaminated needles is prohibited, and use of the mouth for handling needles or needle caps is prohibited. If recapping is absolutely required, the one-handed technique for recapping includes these steps. Place the needle cap on the table. Holding the syringe only, guide the needle into cap. Lift up the syringe so the cap is sitting on the needle hub. Secure needle cap into place. The second step for work practice controls is be aware, often referred to as situational awareness. All team members should practice sharps awareness during any procedure that involves the use of needles and other sharps devices. Key practices for maintaining situational awareness are: try to maintain visual contact with all sharps during use, control the location of sharps to avoid injury to yourself and others, and be aware of other team members nearby and ascertain their experience with sharps handling. When new team members are introduced to an established specialty team, be sure to make them aware aware of the Sharp safety practices of that specialty team and confirm their understanding of these practices. The third step in the work practice control strategy is dispose with care. During cleanup following a procedure, you should be accountable for sharps you use and dispose of these properly. Check procedure trays, waste materials, and bedding for exposed sharps before handling. Look for sharps that may have been left inadvertently after the procedure and transport reusable sharps in an approved closed container. To support these work practices, the UTMC policy states that contaminated disposable sharps should be placed immediately in appropriately labeled puncture-resistant, leak-proof closable containers. These containers should be located near points of use when possible. Containers should be replaced when they become 3/4 full. Environmental Services is responsible for changing out sharps containers unless other individuals are designated within their specific areas. Other safe disposal practices include making sure the sharps container being used is large enough to accommodate the entire device or devices that need to be disposed, keeping your hands behind the tip of any sharps, avoiding bringing the hands close to the opening of a sharps container. Never place hands or fingers into a container to facilitate disposal of a device. Often, pharmaceutical waste containers are located adjacent to or nearby sharps disposal containers. It is important that these containers are never used for disposal of sharps. If after all preventative measures have been taken and a sharps injury still occurs, there are some critical steps that need to be taken to not only protect the team member, but to provide information that can lead to further development of prevention technologies or techniques. These steps are: remove the contaminated item involved in the exposure from the sterile field immediately and notify the circulating nurse and surgical technologist. Wash hands and clean the affected area as soon as possible. Notify supervisor of the injury. Provide your blood sample and 2 contact phone numbers. Complete a safety event report that documents the exposure. If exposed to an unknown source, report to Employee Health or ER for treatment and counseling. To facilitate the steps for obtaining team member and source blood samples, a new InStick kit has been developed and is kept on procedural and perioperative units. Check with your unit manager to find out where they are located. Directions and supplies needed to collect InStick panel specimens are in the kit. After cleaning the wound, receiving emergent care if needed, notifying the supervisor, and giving a blood sample, reporting the sharps injury through the online safety event report app is required. The app is located on UTMC team member intranet Insight and can be opened by clicking on the safety event reporting box on the main page. Once the app is opened, you will need to log in with your UTMC credentials and then click on the team member event icon. Important note: UT GSM faculty, residents, and employees must also report this event to the UT Workers' Comp program called Corvell. Steps and phone numbers for this are listed in the InStick pamphlet or can be found in MedHub or by calling your GSM administrator. You are part of the sharps injury prevention process when you adhere to safe practices and support team members in safer practices. Report injuries or blood or body fluid exposures, sharps injury hazards, and near misses. Participate in training for devices and properly use sharp safety features. If additional training for staff is needed, request that the vendor be asked to come back to provide training. Participate in surveys and device evaluations. If you have not been involved in the selection process or involved in piloting devices, ask about how that process works. Find out how you can provide written feedback on the use of new devices. UTMC Sharp Safety involves the shared commitment of the entire healthcare team to ensure the safety of every care provider and patient in the facility. Your participation in the previously discussed components of Sharp Safety, as well as the activities relating to Sharp's injury prevention, is essential to developing and maintaining a strong, positive culture of safety. Together, we can eliminate Sharp's injuries.